Hi, this is Dr. Lucietto, and I'm here to talk to you for the next few minutes about a drug called buprenorphine. It is a medication that is approved by the FDA to treat opioid use disorder and moderate to severe pain. Now, opioid use disorder is an unfortunate condition that has unfortunately expanded in the United States. We were trying really hard to keep it under control. But by adding more providers to the mix in order to help contact people and help them understand their condition a little better, they have expanded the medically assisted treatment programs as well as the providers who are able to prescribe the medication. It was restricted at one point. It still is a controlled substance, but it was restricted that you needed to have a special DEA number in order to prescribe it. That was taken away several years ago. But there has not been this huge boon or expansion of the use of the medication. Now, if an individual with opioid use disorder can go through a treatment program once or twice, maybe 3 times, but if they can go through a treatment program and actually remain sober without the medication, that's great. But unfortunately, those receptors are calling out for some stimulation, and it's far better to use a drug or a medication that is available and understood and a bit safer than the Russian roulette you're playing on the street. It is not a good thing to be buying things from people who are not required to provide full disclosure as to the side effects and the benefits and deficits to using their substances. So getting back to buprenorphine. Buprenorphine is a drug that is called a partial opioid agonist. It is a drug that kind of works like an opioid on the receptors. There are a number of different receptors. The opioid receptors include the mu receptors, which are the primary target for the opioids, and that includes buprenorphine. All right, they are present in the brain and the spinal cord, and their activation causes side effects like euphoria, constipation, and breathing difficulties. That is not very attractive, is it? But it does provide some pain relief. The delta receptors are the ones that are primarily involved in pain resolution, analgesia, and it also influences emotional regulation. I know. That has its benefits, but it also has its disadvantages. So the opioid receptors in general are the nociceptin receptors, the kappa, the delta, and the mu receptors. Now, I'm not going to get into the biochemistry of these, but down the road, if there are a subset of listeners who would like to learn more about that, I'll be more than happy to discuss those in greater detail. But getting back to the receptors that are stimulated by both opioids and buprenorphine, because buprenorphine is a partial opioid receptor activator. The buprenorphine acts mostly on the mu receptors. Now, buprenorphine is used to replace the dependency that is formed by traditional opioids. Those would be medications like hydrocodone, oxycodone, morphine, methadone. Although methadone is kind of a creature in its own class, but we can always talk about that another time. Anyways, buprenorphine is used to replace these other medications that you can build up quite a tolerance to. That's one of the major disadvantages of the opioids. Now, the advantages include the pain relief, which really cannot be rivaled by anything else. There have been a lot of studies that are completed regarding other medications that are available, and while Tylenol or acetaminophen, as well as ibuprofen, also known as Motrin, you've also got naproxen, those drugs are good and will work on pain, but there are certain pains that they're not quite adequate. Or you have a situation where the individual that is planning on taking them can't take them. You can be allergic to them. You can also have kidney problems, which are more common than people really think. We just don't talk about it all the time when we get together with our friends. But kidney problems will prevent you from using both acetaminophen and the NSAIDs, which include ibuprofen, naproxen, that kind of drug. So there are reasons why people cannot use what is pushed now as the primary pain relief. The opioids can be used in those cases, and there are different degrees of opioids. But getting back to buprenorphine, our partial opioid receptor agonist, that is a drug that is used in many medically assisted treatment programs that are also associated with detox and rehab facilities. You can also access them through any provider who has a DEA license number in order to provide these medications safely. Now, the buprenorphine can be taken daily, and it doesn't need to be dosed all the time. You can take it once a day, twice a day. The situation for each individual is quite different. So you can't just take a plan and say, this applies to everybody. That is not how medicine works. But in general, you can use the drug safely in most people. Now, those who are using buprenorphine are able to function much better than when they're using opioids on a regular basis. The buprenorphine does not have as much effect on thinking and reflexes as well as the function in general of the brain. Now, a brain without buprenorphine is better than a brain with buprenorphine, but a brain with buprenorphine is far better than a brain with some of the traditional opioids. So the medication can be used in the interim. It can also be used for the long term. Now, there are some people who also have pain, which is why they became dependent on the opioids in the first place. You can take the opioids away from them, but you can't take the pain away. Sometimes you got to work on the underlying cause of the pain in order to resolve it, and that does not happen overnight. So buprenorphine can be used in the setting of opioid dependency, which is a physical component of the condition. Now, you can have individuals who are simply dependent on opioids, and you can also have individuals who are dependent as well as addicted. Now, when an individual is addicted to a medication, as a general rule of thumb, it's probably safe to sum it up, although it's not complete, but you can sum it up that an individual is addicted when they try to access the medication in non-traditional means, such as buying it off the street, stealing it, taking it from other individuals. A medication that is intended for you should be prescribed for you. It should have your name on the bottle, not a household member, not a friend. The medication that is used to treat the opioid use disorder is also able to manage some components of pain. So if a person has chronic pain, such as a failed back syndrome or intervertebral disc disorder with bulging discs and sciatica, oh my gosh, some of the combinations that you run across. But if you do use those for that purpose and you become dependent on them, buprenorphine products such as Suboxone, Zubsolv, Bunavail, they can be used in order to help manage both the dependency as well as the pain. Now, the buprenorphine is not without side effects. There is not a drug in the world, including normal saline, of which we happen to be 95% of. Everything has side effects. Heck, oxygen has side effects, and every single one of us needs the oxygen in order to live and survive. But we'll get into that another time. The medication, when it is used, there will be situations, because you can't prevent life from happening. People who are on buprenorphine sprain their ankles, break their bones, unfortunately end up in car accidents. They have situations where they need to have acute, strong pain medicine, such as an opioid. Now, when they're on buprenorphine, you can't use your traditional opioids like morphine or hydrocodone or Percocet readily because you can put a person into precipitated withdrawal. Precipitated withdrawal is not a pleasant creature to run into. Precipitated withdrawal is one in which an individual takes something that knocks those buprenorphine off of the receptors, and unfortunately you end up with the nausea, the vomiting, the diarrhea, the the pain, the irritability. So we try to avoid that, although sometimes it does happen. Now, if individuals are on high enough doses of buprenorphine, they can use things such as tramadol. There have been several studies that have been completed that show that tramadol can be used for acute pain in the short term safely. But if you're dealing with a person who is on low doses of buprenorphine, perhaps that is not the best choice. Now, fentanyl, not the one that you find on the street, not the illegal stuff, but fentanyl as medically prescribed and used, same name, two very different creatures. Fentanyl can also be used to get around the pain receptors. Now, that is, or I should say, get around the buprenorphine on the pain receptors without knocking them off completely. All right. So fentanyl can be used for acute pain, particularly if somebody ends up in the emergency room and then they're going off to surgery. But that is not quite the first choice of the anesthesiologist. So you need to make sure that everybody who is taking care of you understands what you're on. Don't feel bad about repeating yourself. You are your own advocate. You need to make sure the people who are taking care of you understand the full picture. Because if they don't have the knowledge base in order to take proper care of you, then they can access the people who do. Encourage them to contact your primary care provider, if at all possible, particularly if they're the ones who are prescribing the buprenorphine. Because when everybody is on the same page, you get better care. The only way you're going to get that is to advocate for yourself. So, getting back to that, all right, if you have your appendix taken out, if you have your gallbladder taken out, you can't have the traditional pain medicines that are used in these situations, such as morphine or Dilaudid, or which is hydromorphone, or Norco or hydrocodone, Percocet or oxycodone, because they will knock the buprenorphine off those receptors completely and you will get very sick. All right. If you use fentanyl, tramadol, other options, there's also other non-narcotic medications such as gabapentin, pregabalin. There are lots of options. You don't have to understand them completely and totally, but to be aware of them is very important because that's how you can advocate for your health and those that you love. So those medications can be used safely and they need to be encouraged to use them safely. However, if the people who are providing care to you do not understand that you are on the buprenorphine and for the reasons that you're on the buprenorphine, they can't help you when it comes to that. They'll actually unintentionally make you very sick. And it's by no fault of their own, because if you don't give them good information, you're not going to get good results. So remember, your life and your health are way too important to be taken seriously. So you have a great day, and I'll talk to you soon. Bye.